The nurse practitioners are the leaders in the fast track area. I've always been a very hands-on clinical role, so I think I've been able to combine my clinical expertise in a role that's very patient-centred. My name is Tash. I'm a nurse practitioner at Alfred Health in the Emergency and Trauma Centre. I was the first emergency nurse practitioner for adults endorsed in Victoria back in 2006. I did my critical care course in a regional hospital here in Victoria and was working as a clinical nurse specialist. I could see that there was lots of things that nurses could do, but we didn't have the frameworks around being able to do advanced practice. So I applied for a travelling scholarship and went to the United States and Canada, and I worked alongside nurse practitioners who were doing exactly what I thought was needed back in my emergency department. There were so many patients that could benefit from an advanced practice nursing role, so I thought, let's start moving forward. I was very lucky to be successful in getting a position as a candidate here at the Alfred in 2004. It was a fabulous foundation for what the nurse practitioner role has become today. There hasn't been many barriers to our practice, which I've seen in other places, and so everybody got together to make it happen.
Within our advanced practice nursing strategy, currently at Alfred Health we have 30 nurse practitioners and about 120 clinical nurse consultants. We have modelled that over the next 5 to 10 years we'll have at least 160 nurse practitioners and 200 clinical nurse consultants. This is a learning journey for us to see what we need, how do we invest in fulfilling that need, and then keep learning from what these roles can provide us to maximise the contribution of nursing.
In Australia, we're very innovative when it comes to nurse practitioner practice. It's all about what is the need for the organisation and how can we fill that gap. So we have actually taken it to the next step and we are leading the world when it comes to that. I enjoy communicating with my patients and making a difference. That's why I do the role, that's what keeps me coming back every day.
I'd like to congratulate all our nurse practitioners and all our advanced practice nurses who have worked at the Alfred over the years to try and continue to make this one of the great health services in Australia that delivers excellent care all the time for our community.
I really enjoy looking at patients through a holistic lens, also doing the clinical proceduralist skills, but the main thing for me is getting to know the patient. I'm Jess, I'm the trauma nurse practitioner candidate at Alfred Health. I started my nursing journey in 2018 and I did my grad year here at the Alfred, both in trauma, and then I transitioned to ABI for 6 months. From there I went to ICU, which is where I started my Masters of Advanced Nursing Practice, and I specialised in nurse practitioner. And then this role became available, so I thought I'd throw my hat in the ring and give it a go. The idea is that it'll progress from a CNC to a nurse practitioner role. It's one of the first in Victoria for the trauma service. We'll be trained by our 2 trauma medical mentors. I really like the idea of being with the patient in ED and then providing that continuity of care for the patient throughout their entire trauma journey. So this role was perfect for me. I think with our growing population in particular, traumas don't just go away. The more people we have, the more traumas there are. The nurse practitioner service allows no one to fall through the gap. It's like a safety net in some ways as well, to make sure they have all the right scans and all the follow-up care is also done. So it's that continuity of care which is really needed in today's day and age.
Historically in Australia, the majority of nurse practitioners have been in the emergency department or in places like rural and remote. But at the Alfred, where we're seeing the major growth will be in that transition between hospital and community. I think we've got a very supportive organisation that now truly understands the value of nurse practitioners and is willing to invest in their development so that we can have a stronger, brighter, more creative, more efficient and focused health service delivery.
It really helps the patient experience, helps patients feel that they've been listened to. It's closing the loop with the patient and their family. I definitely think it is a pinnacle of nursing. You're a leader in nursing care. Hopefully you're inspiring other young nurses to progress in their career as well, and nurse practitioners are the way of the future.
My day-to-day generally consists of seeing patients down in our day treatment unit. I follow mostly lymphoma patients who are going through active chemotherapy. So patient interaction is a big part of my day. I'm also a resource to patients who aren't necessarily in the hospital setting. My name is Mitchell. I'm a hematology nurse practitioner here at Alfred Health. I completed my Bachelor's of Nursing in 2006, and I worked as a registered nurse there at a hospital. I saw other nurse practitioners in the field and thought, hey, this is something that I would really like to pursue. I just loved how they were able to practice independently. I completed my master's in 2012 and worked as a nurse practitioner in the States. I started in a clinical nurse coordinator role here at the Alfred, which I felt more comfortable in coming from another country. After doing that for about 4 years, I did speak with my managers just about my desire to get back into the nurse practitioner role. And they were so supportive, and everybody was great and worked with me to do what I needed to do to make that happen.
So at Alfred Health, we're starting to discover how valuable these roles can be in areas like cancer, aged care, rehabilitation. Our medical staff, our senior nurses, our allied health professionals are embracing this role and looking to see how we can create communities of practice where clinicians work together, learn together. It's all about that collaboration with the rest of the clinical team and having a shared vision as to how we'll create these roles and support these individuals.
I think the nurse practitioner role will become more and more in demand here in Australia. It's a great position that really fills a gap in not just hospital healthcare settings, but regional and smaller towns as well. It's a great thing to be able to provide better care for patients.